Republican state attorneys general, 19 of them at last count, have indicated their intention to challenge the health care reform bill in the federal courts, specifically the provision making health insurance mandatory for every single American. Now, I have to tell you, folks, that as I read the Constitution's Commerce Clause, Congress does have the authority it needs to regulate insurance, but with the high court so evenly divided between conservatives and liberals, there's really no telling how the justices will see and rule on this issue. On the telephone with me now, prominent Republican House member Darrell Issa of California. Congressman, welcome. But I have to ask you right off the top, so even if this bill passes tomorrow, this is a far from done deal then?
It's a far from done deal, obviously, because there are some unanswered constitutional questions and mostly states' rights questions. But having said that, some portions of the bill, if signed by the president, will clearly survive. So, for example, the ability to tax, the court has never second-guessed. So we may not get some parts of the health care or the mandates, but we may very well have, for sure, the higher tax.
Well, let me ask you this. I'm asking everyone tonight, Congressman. I've got the urger right here. This is the current whip count. Now, this is not cut and dry, yes or no. These are the estimated vote tallies, but as of right now, it's 217 for or leaning for, and 214 against or leaning against. What say you? Do you expect this to pass the House of Representatives, your body, tomorrow, Congressman?
Yeah, they will get the votes.
And how you feel about that? I mean, do you see, let me ask you a better question. Do you, I mean, some of the language I have heard from Republicans is truly apocalyptic. Do you think this is like the Mayan doomsday 2012? I mean, is it going to be something that profoundly unsettling to the fabric of American society?
Well, I hate to disappoint you. I can't be apocalyptic. What I would say is the taxes are a step in the wrong direction. The quote fixes here, which is simply more paying for people's health care without any real cost control. Geraldo, the simplest way for the American people to understand why I'm not voting for this bill, Canada has a single-payer system and covers everyone. We can debate about how well. They do it for 9% of their GDP, or roughly 9% of our GDP. We, on the other hand, spend 18% of our GDP, and it's expected to rise in percentage of our gross domestic product. Why in the world would I vote for something that costs money, doesn't cover everyone, and doesn't take care of the fact that in America, health care costs double and will continue rising what it does in single-payer countries? I'm not promoting a single payer, but Canada, Britain, all these other countries have other cost containment ideas, including, be honest, limitations on suing your doctor in your hospital that drive down the cost of health care.
I think tort reform is a good idea, Congressman.